In this video, we are diving into the first step of urine formation, glomerular filtration. Remember, urine formation has three main steps: filtration at the glomerulus, then reabsorption and secretion in the tubules, and finally, excretion of what's left. Today, we are zooming in on filtration, how blood enters the kidneys, passes through specialized capillaries, and gets transformed into something we call filtrate. So let's begin. Blood enters through the afferent arteriole and reaches a tight ball of capillaries called the glomerulus. Here is where the magic happens. Some substances in the blood get filtered through a specialized barrier and enter Bowman's capsule. The resulting fluid is called filtrate, or you could say pre-urine. But not everything gets filtered. Larger components like blood cells and certain proteins exit through the efferent arteriole instead. Let's now explore the star of this process, the glomerular filtration membrane. This membrane has three key layers, and each one plays a special role. First, the endothelial cells of the glomerular capillaries, the basement membrane, and the third layer is the visceral layer of the Bowman's capsule, the podocytes. So let's get into more details on each one of them. The first layer is the endothelium of the glomerular capillaries. It's full of small pores called fenestrations, about 70 nanometers wide. These allow tiny molecules like water, glucose, and ions like sodium and chloride to pass through. But larger things like red blood cells, white blood cells, and platelets, nope, they are too big to pass through this layer. The second layer is the basement membrane, and it's not just a structural layer, it has a negative charge. This acts as filter by size and charge. So if a molecule is too large or negatively charged, it's blocked. For example, the protein albumin has a size of 69 kilodaltons and a negative charge. So sorry albumin, you are not getting through. The third layer is formed by podocytes, the visceral layer of Bowman's capsule. These podocytes have food processes that interlock, forming small slits called filtration slits. Between the slits and the negative charge, only certain substances can pass through. Let's go through a few of them. Small molecules like water, 0.3 nanometer. Sodium ions, 0.9 nanometer. And chloride ions can pass through easily. Even though chloride is negatively charged, it's so small it sneaks by. Same for glucose, 180 daltons, urea 60 daltons, and creatinine about 113 daltons. All small, all able to filter through the membrane smoothly. Now let's talk about what cannot pass through. Blood cells, way too large, measuring over 6 to 8 micrometers. Plasma proteins like albumin, large and negatively charged. Protein-bound substances like calcium bound to albumin. Even free hemoglobin due to size and charge cannot make it through. So why is this important clinically? If we find red blood cells or proteins in a patient's urine, that's a red flag. It likely means there is a damage to the filtration membrane. For instance, in glomerulonephritis, you will see red blood cells in urine. In nephrotic syndrome, you will find significant protein loss. We call it proteinuria. And that's a wrap on the glomerular filtration membrane. We've seen how your kidney acts like a fine-tuned filter, letting the good pass and blocking the rest. If you enjoyed this breakdown, give it a like and subscribe for the next video in our urine formation journey. We are heading to factors affecting glomerular filtration membrane. Stay curious, future doctors, and I'll see you there.